There are different justifications for why testosterone substitution treatment may be executed on a patient. Be that as it may, this chemical treatment isn't ideal for everybody. How testosterone replacement therapy works. The possibility of TRT is genuinely straightforward. Your body has a lack of testosterone, so TRT replaces that deficiency. However, the treatment might be something similar. What causes the shortfall might be totally different. Some will have experienced low T levels their whole lives, while others might be encountering it interestingly. Testosterone is a significant chemical in the capability of the male body. The substance flags more hair development, the improvement of additional muscles, actuating sex drive in men. At the point when levels are too low, most men become mindful of it because of their low sex drive or even execution issues. At the point when those levels increment, it standardizes substantially execution once more and rebalances the body to fill in as it did while delivering testosterone naturally. It might take an experimentation to sort out the ideal testosterone level and organization strategy that turns out best for you. Be straightforward with your PCP pretty much the entirety of your side effects to guarantee your solutions are planned so that makes dosing simple and incorporates expected supplements. Testosterone replacement therapy. Testosterone substitution treatment is the most common way of supplanting the testosterone that is lost because of a physical issue, a condition that is available upon entering the world, or a sickness that causes low testosterone levels. It can likewise be given to supplant testosterone levels that have fallen because of an arteriectomy evacuation of one or two of the gonads. What is its monitoring in testosterone replacement therapy? Before you start treatment, your primary care physician will test your testosterone levels 2 times to lay out a standard. This will include a straightforward blood test. Since it might require an investment to find a strategy that will function admirably for you, your PCP should screen you during the start of your TRT. There is a wide range of treatment for low T, so your primary care physician will actually want to evaluate the body's response to the principal dosages to decide whether less or more is fundamental. An excess of testosterone can cause gambles. Higher testosterone levels in the body have been related with an amplified prostate and development of existing prostate disease. Assuming that you as of now have prostate disease or are in danger of creating it, TRT may not be the most ideal choice for you. Following 3 months of TRT, your primary care physician will test your testosterone levels in the future. On the off chance that you're as yet not inside OK ranges, they might change the dose or organization strategy. A few men will retain specific medicines better compared to other people. Checking is essential for the cycle with TRT. Specialists will test you in the future at the half-year point and when a year after that, however long you're on the treatment. Ask your doctor about testosterone replacement therapy for men. Testosterone swap treatment for men can be an incredible choice in the event that you're encountering strangely low degrees of testosterone. You really want to ensure you just seek after this treatment with your primary care physician's management, yet when done accurately, it can work on a great deal of region of your well-being. Converse with the PCP about whether TRT is a decent choice for you. What is its treatment? There are various options for the administration of testosterone replacement therapy. The first one is patches. The body can retain testosterone through patches, which is not typical to utilize. Be that as it may, they might cause skin aggravation and should be applied on various occasions every day. Moreover, not all patients assimilate this medicine well. Effective gels. These are helpful to apply, yet safeguards should be taken to ensure that the skin has been presented to the TRT gel doesn't coincidentally come off on other body parts. Ladies and youngsters ought not to be presented to these gels. Buccal patch. This kind of fix, which isn't ordinarily utilized, is put on the gums 2 times each day. It's helpful to utilize, yet may cause gum aggravation. Infusions. Intramuscular injections are given each 2 to 10 weeks, contingent upon the endorsing doctor. Infusions are in many cases the most affordable choice and give more huge expansion in testosterone levels with the best side effect improvement. Subcutaneous. This type includes pellets that are put under the skin each 3 to a half year. Whenever they are directed, the pellets require minimal measure of upkeep and an elevated degree of consistent dosing. Be that as it may, they really do require minor medical procedure each time another measurement is expected. Further pellets can expel, and likewise with any method, there is a burden and a little gamble of disease. Oral. Jatenzo or testosterone undecanoate containers are a fresher oral drug. containers are advantageous and dissimilar to some past oral testosterone plans not remembered to cause liver harm. What is hypogonadism? Male hypogonadism is a condition where the gonads don't deliver sufficient testosterone, don't create sperm, or both. As per one review, 20% of men more than the age of 60, 30% of men more than 70 age, and half of men over the age of 80 have hypogonadism. A man might be brought into the world with hypogonadism, or it might foster sometime down the road. Testosterone declines by 1% each year, 10% each decade, beginning at age 30 years in all men. TRT for hypogonadism. Testosterone substitution treatment is a typical treatment choice for men with low testosterone levels and side effects of hypogonadism. TRT can create exceptionally sure outcomes and even reason an individual to recapture manly characteristics that were lost because of low testosterone creation. Utilization of TRT for those with hypogonadism has been demonstrated to be viable and for the most part protected, yet extra clinical examination information is expected to completely lay out long-haul security. Benefits of testosterone replacement therapy. Everyone is unique, so the advantages you could see from TRT will shift. Normal advantages, remember, an increment for energy level and sex drive, which can prompt more agreeable connections. You might see a lift in temperament too, albeit the level men find in this lift differs. Since testosterone advances muscle improvement, there might be an observable lessening in fat and an expansion in bulk. Furthermore, better bone thickness and further developed insulin responsiveness can likewise happen from TRT. Harder or all the more enduring erections can be clear, however, it will rely upon whether your erectile brokenness is because of an absence of testosterone or not. Assuming erectile brokenness go on subsequent to starting TRT, talk with your PCP about different issues that might be causing it. Now at last we're going to talk to you about the risk of testosterone replacement therapy. Testosterone substitution treatment might seem like a Marvel fix. You rub a gel on your chest and you have more energy, better sex, not so much fat, but rather more muscle. However, similar to any hormonal clinical treatment, TRT ought to be painstakingly checked. TRT can likewise add to rest apnea, so assuming that this is the sort of thing you as of now battle with, let your PCP know. There are numerous positive advantages of TRT that might improve the general personal satisfaction for those with low testosterone levels. Prior to taking TRT, analyzing every one of the advantages and disadvantages of its protected and successful use is significant. In certain cases, the advantages of TRT might offset the dangers. Remember that despite the fact that TRT has been connected with BPH, that's prostate organ expansion, polycythemia, and rest apnea, the proof isn't adequately significant to back up large numbers of the potential dangers completely. Having a top-to-bottom discussion with your medical services supplier prior to settling on TRT is a significant initial step. With legitimate observing by the medical care supplier, including exhaustive well-being history, customary office visits, and incessant lab checks, TRT might be a protected and powerful therapy for certain individuals with low testosterone levels. Let us know your thoughts in the comment section below, and also make sure that you're subscribed.